told you last night, there's what some are calling a crisis in care right now in Henry County. Doctors who deliver babies at the Henry County Medical Center received termination notices earlier this week. Good evening to you. I'm Carrie Sharp.
And I'm Hunter Hoagland. They're being let go because the hospital has decided that it has no choice but to close its Ob-Gyn department. A move some will say put the lives of both women and babies in danger.
Consumer investigator Jennifer Krause went to Paris, Tennessee to find out what is behind this closure. So, Jen, what did you find out?
Well, some are blaming TennCare. Then there's, of course, Blue Cross Blue Shield, the TennCare provider that some say is putting money over medicine. But as we found, there's a lot of blame to go around. 2 hours outside of Nashville, in the small town of Paris, perhaps best known as home of the world's biggest fish fry. Where were you born? Just about everybody.
It was Henry County General Hospital at that time.
Know someone.
My youngest son was born here.
Who was born.
And their children have been born here, and their grandchildren have been born here.
At the Henry County Medical Center. But that's about to change. The hospital recently announced it is closing the Ob-Gyn department here.
You cannot provide that service for what our payment rates are.
You see, 70% of the women who deliver here are on TennCare, and most of them are enrolled in the Blue Cross Blue Shield program known as Blue Care.
The objection's ordered.
In 2002, state lawmakers passed a law declaring TennCare reimbursement rates proprietary information and therefore confidential, meaning hospitals are not allowed to discuss how much they get from Blue Care.
Maybe it's time to rethink how it works.
Hospital administrators in Henry County are so concerned, though, they decided to break the rules so we and you can understand their predicament. But you haven't had an increase in years.
Right.
And healthcare costs have gone up.
Right. Extraordinarily, yes. Blue
Care pays the Henry County Medical Center just over $1,700 for a mother to stay in the hospital and deliver her baby, and an additional $335 to care for that baby once it's born. In fact, it's kind of a running joke around here that it costs more to stay at the nearby Paris Landing State Park Lodge than Blue Care pays for a full-term healthy newborn.
It's crazy.
But most agree it's no laughing matter. And it turns out Blue Care has been paying Henry County these same rates since 2019. And get this, Blue Care is actually paying substantially less now than it was for the very same services back in 2009. We asked Blue Cross why, but they refused to answer.
Holy smokes. I mean, that obviously there's lots of healthcare inflation since 2009.
Michelle Johnson is the executive director of the Tennessee Justice Center, a nonprofit public policy and advocacy organization and law firm that represents TennCare patients. And she was shocked to hear the Henry County Medical Center is being forced to eliminate its obstetrics program because the TennCare reimbursement rates don't come close to the actual costs.
It's immoral that we have a government that is responsible and that they don't roll up their sleeves and say, we have to solve this. This is a crisis.
Hospital administrators thought so too. They recently turned to TennCare for help.
And the response is, well, you've signed a contract and have accepted those rates. If you want better rates, just go negotiate with them.
But CEO John Tucker says for a rural hospital like Henry County, that's easier said than done.
In small independent facilities, there's just not a lot of ability to negotiate. If you're a St. Thomas or a TriStar system, you have lots more leverage.
And what makes it even trickier is that 2002 state law that makes TennCare reimbursement rates confidential. So you don't know what other hospitals are getting or how that compares?
I don't.
It's not a fair fight.
Michelle Johnson also found it concerning that with Blue Cross, the rates essentially don't change unless the hospital comes back and asks for more money.
Why is it the burden on this little hospital to say we really want to take care of these patients?
Well, Henry County concedes they have not asked for a rate increase in 4 years, in large part because they were focused on COVID and had a lot of turnover, going through 2 CEOs and losing several other top administrators. In early June, the hospital asked Blue Care to significantly raise its reimbursement rates for maternity care. And while a Blue Cross spokesperson told us whenever we receive a rate request from a provider, we give it our full consideration, more than a month later, Blue Cross is still considering the request.
I am confident other hospitals are getting a lot more than us for the identical service.
Longtime doctors here are frustrated.
I think if you really cared about women and babies, you would compensate equitably. It's not a hospital that's asking for more than their share, but it's a obstetrical unit that's asking to be treated fairly.
Several years ago, Blue Cross spent $750,000 to build this large playground in the city's Eiffel Park. Blue Cross even promotes it on its website as a state-of-the-art outdoor recreational and fitness space. But who will play here, some ask, in a couple of years if the hospital stops delivering babies in September? Michelle Johnson says that's on the state and TennCare.
They can't slough that off on Blue Cross. They can't push it off on Henry County negotiation, and they can't give it to pregnant women and say, you know, fight for your prenatal visits. Like, they are ultimately responsible, and they have a duty to fix what is broken.
Both TennCare and Blue Cross turned down our requests for an interview. Now, here's the thing. As folks in Henry County point out, babies are going to continue to be born, and when Henry County closes its OB unit, mothers are simply going to have to go elsewhere to deliver, where it's likely Blue Cross is paying more for the services. So in the long run, Blue Cross is going to end up having to pay more money one way or another.
It is such a mess, but what are pregnant women there doing right now?
As you might imagine, they're scrambling. I mean, most of them have doctors there they love and they've been going to for a while. They don't want to leave them, but they can't wait until September 1st to look for a new one. In fact, a lot of doctors won't take you as a new patient if you're more than 12 weeks along. And if you're on TennCare, I'm told, trying to find an OB is even more challenging.
All right, Jen, thank you.